So many of us spend so much time in this position right here. Now, if you look at the degrees of head, how much degrees your head goes forward, just bending your head forward, you can see 30 degrees is 40 pounds of weight in the head, 45 degrees is 49 pounds of weight in the head, 60 degrees is 60 pounds of weight in the head. Now, you're asking me, why am I talking about neck when we have shoulder problems? And I'm going to tie all this in, because if you look at those guys, the man's spine, the third, fourth, and fifth picture, look at the neck area and look as you're getting internal rotation and pronation, which means we're getting pronation like this. You can't look down with your shoulders back. So that's number one. So I just want you to look at that for a second. Okay. The other thing is, we look at rounded shoulders. Many of our people out there, listeners right there, have this particular condition. Very, very serious problem. Hi, Deborah from Florida. Thank you, sweetheart, for being here. Richard from UK. Caraco. Susan we have here. We have Zaran from Pakistan. Awesome. We have B. Dunn from San Francisco. Beautiful. Well, look at this posture right here. This is really common. You're probably saying, man, this looks familiar. You know, people say, I got this bad posture just from slouching a lot, looking down a lot, because most of you, hey, Joan, most of you are gurus on computers. Most of you are the gurus on the smartphone. And we spend most of our time looking down. We write, we read, we drive, everything with our arms out in front of us. So as we spend all this time, looking down and doing all these types of things day after day, what happens is we start affecting specific muscles. Let's look here. The rhomboid muscles, which are the muscles between our shoulder blades, one of the most important muscles that are overly looked at. Zubaida from Germany, beautiful. Netherlands, wow. You guys really motivate me. That's awesome. Look at this young lady right here. She has pronation of the shoulders, rounded shoulders. She has uninhibited rhomboids. The rhomboids between the shoulder blades are extremely weak. Tight upper trapezius, levator scapula muscles back in here. Hi, Eliv Palek. How are you, sweetheart? Fernando from Brazil. Hi, hey, my friend. Look at the head on her. Look what's happening with the muscles in here. The inhibited neck flexors, the anterior deep neck flexors, extremely weak. We talk about chin tucks. Okay, you look at a lot of my videos, we talk about chin tucks. Chin tucks are so important, but one of the most important things here when it comes down to shoulder problems is right in that lower red where it says tight pectoralis. Now those tight pectoralis muscles is a big, big problem, because those tight pecs are taking the shoulders and they're pronating them. And the problem is that when we pronate our shoulders, the space in the subacromial region becomes diminished. Let's see if I can find this for you. Just bear with me, because I got a lot of stuff in here. We look at the shoulder bursa. No, yeah, we can look at that one right there. Let's look at that shoulder. Look at the rotator cuff in there. We can see it in there. We can see the acromion where it says acromion. The space underneath that acromion is basically the space that all you have. You have the rotator cuff going through there. You have bicipital tendon coming over the area. And I'll show you another picture where you can get a little bit of anatomy, so just bear with me. That redness right there is that acromion, is that bursa. And that bursa, when it starts to become pronated, because we're internally rotated, that bursa starts to become inflamed, starts to swell. And that's what causes a lot of limitation of range of motion. And when you have poor posture, because of tight pecs, and because of weak rhomboid muscles, this causes a narrowing in the subacromial region, causing encroachment and inflammation. It becomes a chronic vicious cycle. And when you run to doctors, hello, Sandy Linder. When you run to doctors and they give you steroid injections, okay, let's look, guys. I'm going to jump around the clock a little bit here. Let's see. Does any of this, let me see. Does any of this look familiar? Ouch. Ow. Ow, that hurts. That's right. That's what a lot of the guys will do today. They're going to put cortisone inside a joint, and they're going to weaken the joint muscle, weaken the bone. They're going to increase the sugar level in your bloodstream. They're going to cause the joint to start to corrode, because cortisone will eat away bone over time. That's why they tell you, you can only get this so much, every couple weeks, couple times a year. And that's a big problem, because, those particular areas of cortisone is dangerous. People get it every day. and it hurts, okay? And I'm going to tell you some different things that you're going to be able to get through these things today. I'm going to teach you all kinds of different things. Now, if you look here, you look at the Impingement Syndrome model. All right, I'll blow it up a little bit for you. Let's look here. You got shoulder impingement because that bursa underneath that subacromial region is aching. It's swollen. And if you look in the middle there, you got the humeral head. You got the bursa swollen. It's pushing up against the acromion, and it's impinging because it's all swollen. So instead of just trying to find an easy way to try to get rid of this, we got to get to the root of the condition. And we have let me see, Oklahoma. We have Ice T. How you doing, Ice T? Nice to see you here. Teresa, how are you, sweetheart? But this is something that's very important, and I'm going to go over some important things that's going to hit this thing right on the tail, man, because I know that we can get rid of these things. There's a lot of people suffering out there, and these things can be very, very chronic, and it's very, very painful. Now, the first thing I want to tell you, basically, when you have a problem, I want you to look at this. This is really important. Hopefully you can read this because I'll go over it briefly. But if you have inflammation, and you got people out there putting heat on inflammation, Bosnia, Zeliko from Bosnia, wow. Zubeda from Germany, awesome. Ice, so important. Acute phases. We want to reduce and constrict the blood from getting to the area in the initial phases, the first 72 hours. And if you're putting heat directly on these particular conditions, you're going to make the problem worse. One of the best things you can do is have an ice pack in your freezer and take that ice pack out and put a paper towel over it and apply it right on that shoulder area about 10-15 minutes every couple hours. And I'm telling you, it's going to do tremendous things for you. Ice is probably one of the best therapies anywhere in the world. Okay, the problem with anti-inflammatories is you're destroying your kidney, you're destroying your colon and your stomach, you're just tearing it apart, your gastrointestinal system. You got to be real careful. People who have lots of pain, my favorite is turmeric, ginger, quercetin, bromelain. These are all natural anti-inflammatories. So we'll talk about that, Tom. Rice, you're ahead of me, man. You're a smart guy. So yeah, rice is important, but I'm going to take that just one step further because the ice is good in the initial phase. And then we talk about, let me see if I can find that for you. You guys are just too smart for me here. Hold on one second. Now, if you look at this, a little heating pad, I like moist heat. Moist heat is better than dry heat, okay? Moist heat penetrates into the tissues. Dry heat doesn't penetrate as deep. You can get moist heating pads, a hydroculator pad, wet hot towels, hot showers, whatever you like. It's very, very good. Moist heat about 20-25 minutes. Don't sleep with it, guys. You're going to burn yourself. Not good. Too much of anything is no good. Let's go back to what we were talking, what he mentioned about rice. Yes, it is rice, but let me just go to the other guy called price. If you put the P in front of it, it is, you are absolutely correct, by the way. This is the mnemonic you should always know after an injury. Price, we're going to protect the area. We're going to rest it. I, we're going to ice it. C, we're going to compress it. And E, we're going to cause elevation. All right, so price is a very important thing. Price is something, put it in your back pocket, put it in the back of your mind, and it's something that will really do you a lot of good. Okay, so we look at, oh, I don't even have this guy here. Let's see. We looked at the rounded shoulders there. I want to go over a few things here. We looked at here about text neck. We look here about shoulder impingement there. You can see again the bursa underneath the subacromial region. That's primarily what we're dealing with there. We talked about the, let's see here, one second. Okay, let's see if we can get this here. 1 second with me. If you look at this picture here, I wanted to bring this out. Why is this important? Because we talk about forward head posture. Forward head posture is one of the biggest things that affects shoulders. People understand that orthopedic surgeons, physiatrists, chiropractors don't look at the body mechanics thoroughly enough to diagnose a problem with the shoulder. And I'll give you a good example. I've done a lot of specialty in extremities. So people have a tennis elbow. Okay, I'm just throwing this out in third base right now to give you an idea. If you got a tennis elbow here, guess what? That problem's coming from the wrist because the extensors are totally contracted, usually a problem in the carpals. Okay, we can adjust the carpals and this starts to go away. So what I'm telling you is that when you have a shoulder issue, it doesn't come most of the time directly from the shoulder, unless it was a trauma. But if you look at the plumb line here, the plumb line should be like that first man right there, going right down his ears. And as you see, as the head goes forward, so does the shoulders. That is extremely important. As we go here and show you here, we've talked about this many times in my videos, but the average head weighs 12 pounds. So for every inch you go forward, it's an additional 10 pounds, and for 2 inches, for 2 inches is 32 pounds, 3 inches is 42 pounds. That's when we start to have problems in the shoulder. Look at the shoulders. They rotate. Look at the third picture, the 42 pounder. That's the amount of weight the head weighs when it goes 3 inches, and look at normal posture. Look at the shoulders. It's changed. The dynamics, the biomechanics, everything has changed. So when we go forward in that forward head position, that is causing serious problems. His problem here shows rounded shoulders, poor posture. Again, we can see weakness of the rhomboid muscles. Those pec muscles are extremely tight. We have shortened and weak anterior muscles. The back of the traps start to pull. The levator scapula behind the neck starts to pull, starts to cause us all this deformation, leading to disc degeneration, leading to herniated disc, bulging disc, disc degeneration, osteoarthritis. Very, very serious issue that is overlooked every single day. This is why it's so important to have good posture. There's no one here on the internet that probably preaches posture more than I do, because I've seen it for all these years. I've seen what goes on. We looked at the, let me see here, let me just see one thing here. Okay, now we're going to kind of go into the good stuff. I know a lot of people are looking into this. What can I do for all these kind of things? Well, one of my favorite things right here, I like this little guy right here. This little guy right here is a shoulder pulley. One of the worst things that we can do for our shoulders is nothing. So people have bursitis or adhesive capsulitis or a frozen shoulder. What do? Well, you're either going to put an injection in there, but it's not going to help the problem, because you got to restore movement. Once you lack movement, you're in trouble. Once you regain movement, it's yours. So you need to make sure that you have proper movement in that shoulder. So that is a shoulder pulley right there, and it's really important. Now, why am I showing you this? Because look here. You can take your good hand, okay, and you can pull the bad hand up by using your good hand on a pulley. Here's another picture right here. I can throw this out at you a little easier. That makes sense. You see what I'm doing right there? That shoulder pulley you can get on Amazon. They're very cheap. You can get them anywhere, very inexpensive. And this can really help frozen shoulder. I mean, you're saying, wow, I never knew that kind of stuff. Canberk from Turkey. Wow. Richard, your partner just had a steroid injection 2 days ago. The pain now is worse. Yeah, I would still ice it, by the way. Bangladesh from India. We have Faith there. Nice. Thank you for joining us, guys. So that shoulder pulley is really a lifesaver, and that's something that you really should get if you're having chronic shoulder problems. You need to really do that particular exercise to break that up. Internal rotation, external rotation, very important. So we want to make sure we strengthen rhomboids. Now, if you are having internal rotation, that is one of your main ingredients of why, thank you guys. Okay, thank you. That is one of your main ingredients why you're having this shoulder bursitis. Now we're going to go into some nut and bolts. Okay, very important stuff. This is kind of like my favorite stuff here, and I'm going to kind of start from the beginning here. Let's go into, let's see if we can remove this, guys. Just bear with me. Thank you. All right, now these are some great things that I really like you guys to start doing. First one is called stair stepping. Okay, if you take your finger and you walk it up a wall like this, just walk it up a wall, because people who have bad shoulders, hi, Onzi Haza from London. Hi, sweetheart, thanks for being here. When you walk up a wall, just like this, like your fingers, like you're stair stepping, okay, that's going to help you raise your shoulder. As we said, one of the most important things that you can do is increase mobility of your shoulder. Extremely important to do that. The next thing is, we look at this picture right here. This is external rotation. External rotation, we can use a little band, and we want to externally rotate by bringing the arm outwards like this, okay? See if I get in the camera here. So if we grab something here, and we just keep the elbow close to ourselves, we want to externally rotate. I'm a big believer in more external rotation than internal rotation, because when you do too much internal rotation, we make the condition worse. Now look at this picture here. You could just go ahead, take your bad shoulder, put it up on a desk, and lower your body. One of the best things for the cuff. Now people, you don't do this because it hurts, but I'll promise you, if you increase mobility in that shoulder, okay, and you can go ahead and release those adhesions, you're going to see a lot of good changes. Now, I recommend anyone out there with chronic shoulder problems to always get evaluated with a physician or a doctor to make sure that there's nothing seriously wrong. But here, I just want to go ahead and give you specific exercises that you potentially can do to help a lot of your underlying condition. This is called pendulum. This pendulum exercise is designed to help this increase range of motion. You can do it first without anything in your hand. You're going to just go in little circular motions. You can go clockwise and you can go counterclockwise. And then if you are okay with that, you can put a light weight in your hand and then you can actually do those as well, okay, as it shows you here. You can go clockwise, you can go up, down, horizontal on an angle, and you can start putting it through different ranges of motion. Very, very important. Okay, now here is internal rotation. If you see the guy there, he's kind of bringing it internally. A lot of orthopedic surgeons, a lot of therapists love pushing this exercise with frozen shoulder. Now, it's okay if you do, my formula is I like to tell patients do like 1/3 of what you do for external rotation. I think that too much internal rotation is going to make the condition worse because we are affecting that subacromial space. So that is something that I just want you to become aware of. Here, a great stretch. I like this stretch. Wow, it feels really good. I can just see what the girl's going through there. That's a great stretch. You can just do that on your own chair at home. You can look through this video and that you can just actually go through this, and I think it can really help you a lot. Again, we talk about the shoulder pulley there. These are rhomboid exercises, good for the rhomboids in between the shoulder blades. You can get a nice little elastic band or any type of something that's got a little durability. Take it and pull those shoulder blades together, nice and easy. Squeeze those shoulder blades back to help strengthen those rhomboids. A great rhomboid exerciser. This is what actually keeps the shoulders back. So when you keep those shoulders back by doing this rhomboid exerciser, your rhomboids are very weak because we spend our time doing this, hunching all day long. Great exercise. I really love that exercise. Okay, let's go ahead and let me see if I can get rid of this one. 1 second. Oh, see this little guy right here? Well, I wouldn't say little guy. Just taking your hand and just opening up the joint, moving the joint around, okay? That's why you have another arm, to utilize that to hopefully put mobility into the joint, because we talked about frozen shoulder. One of the worst things we can do with it is nothing. So putting mobility is good. I like this too. This is really good for the chest. It opens up the chest muscles. It gets you to breathe easier. It gets you to sit up higher up. It really stretches the anterior deltoids, helps release a lot of it. Now, Teresa's saying, gosh, that's killing me. Now, if any of these exercises hurt you, don't do them, okay? You don't want to be a hero because of an injury. You want to do those things that work with you. So the reason why I'm explaining and going over all these with you is so you can have a better understanding about these particular exercises, just in case you needed to utilize something on your own. Now, here's another great one. I've done some videos on this, but you can see taking a broomstick, taking your good hand and just pulling it up. As you pull it up, your other arm is going up. So the idea here, guys, girls, is to try to put the shoulder through different ranges of motion. Very important. It's the adhesion. The adhesions are like glue, and that glue is a substance that just keeps everything tight and locked. So if we can increase mobility gently, okay, not forcefully. Now you might have been walking around with this for months or years. It's not gonna go away overnight. But I can promise you, if you put range of motion and break those adhesions down, you're gonna see a lot of good positive changes. Here's another one you can do sitting down. Just take your other hand, pull it in a different range of motion. I like that one. The towel. You can see my videos. I have the towel type of exercise. The towel, you can actually pull it down behind your back. These are great exercises, guys. And most of the people here, hi there, Alicia from Spain. How you doing, sweetheart? These are great exercises, and I think that these are things that you really need to do. Here's one laying down on the pillow. Just bringing your hand over your head, put it into a different range of motion. There's the chest stretch again, something really, really good. Steve mentioned the rowboat. The rowboat can be done too if you can do it. Raphael from Portugal, nice to have you here. So that chest exercise, very good to stretch the pecs, pectoralis minor. I recommend people to do that one. You can actually put your arms lower, put a little higher to get a different angle on the pec. I think that's a great exercise. Here's one, just taking a light weight and you can externally rotate it. Okay, you can just let that weight kind of fall backwards. All right, what she's doing right there, just to kind of stretch it. But be very careful on that one because I'm not big with people using weights, particularly who have real chronic problems. Now here's a little type of isometric exercise. You can see, put a pillow against a door or a wall. You just kind of push outwards. Now what we're doing here is we just push out like this. We're just contracting the muscle. You know what they say, you don't use, you lose. So it is important to isometrically contract those muscles so we don't let that muscle waste away, because when you stop using a muscle, the atrophy and the muscle will get smaller and make you much weaker. That's a catch-22 when you have an injury. Here's another one, putting the elbow close to the body and just pushing in, isolating different muscles. Very, very good. Let me see here, 1 second here. Here's another one. We talked about the pendulum. We mentioned that earlier. Rhomboid strengthening, you can do this just laying on your stomach, pinching the shoulder blades together. That's another good exercise. You don't need weight, guys. Just these little areas to isolate. Anna from Switzerland, hi sweetheart. Just to isolate those rhomboids. Now those rhomboids are right between those shoulder blades. And those muscles are extremely important that they are strengthened, because in most people, they are not. Okay, so I want to make sure. So we talked about the shoulder pulley here. Shoulder pulley I like. Here's the other shoulder pulley here. I like these because this helps increase mobility. We're using the other arm. Understand that when we have problems in the shoulder, you have to utilize the best that you can utilize. If you don't have a shoulder pulley, you have to use a towel. You have to use a broomstick. You have to use your other arm. As you see here, you can take your other arm and just pull the other arm backwards. Gently, guys, really gently. All right, we don't want to be a hero. All right, we want to subtly work this. Now, I like this too. You can grab onto the wall. You can bring your whole body down as you stretch the lat, stretch underneath the shoulders, stretch up in the shoulder area. Excellent, excellent stretch right there for shoulder bursitis, adhesive capsulitis, to help increase that mobility. Here's another towel one. You can use your other hand. You can be creative. You can kind of pull that in different angles, different positions, a little higher, a little lower. Excellent one. I love that. Here's one, again, we talked about grabbing the other hand. Now, a lot of you may have problems bringing your shoulder back. So you need to be very creative. And sometimes if you can't do it on your own, you get your partner, your loved one, your friend, your cousin, your mother, your sister. You get someone to be creative, but you got to start putting it through range of motion. You cannot leave a frozen shoulder alone. It's as good as putting water in a freezer, and it's going to come out real hard, just like an ice cubicle. We call the icicle. Okay, so being in pain, no good. If you just tuned in with us, I'm Dr. Mandell. We'll be finishing up real soon. This is something that everyone sees all the time. You might have had this problem done before. Just be real careful of cortisone. Cortisone eats away bone. Cortisone will screw with the sugar level in your body. Cortisone weakens your immune system. Cortisone, it's a steroid, does a lot of negative things. So you need to be real careful. But this kind of condition, why is it good that you're here, guys? Because you can really help educate a lot of people. That's what this program's all about. Not all of you may have shoulder problems, but you might have a shoulder condition in the future. But hopefully you won't, because I think that if you really, by the way, I want to mention one thing here. We're going to talk about the rotator cuff, but if you have a potential posture, rotated shoulder, bad posture, forward head posture, rounded shoulders, you are going to be prone to have shoulder problems, because that rotation, that internal rotation is going to cause a narrowing of the subacromial bursa, and that is going to compress it. If you look at the acromion on this, where it says acromion in the upper right there, right below it, just inside, that redness is all that rotator cuff. So if you look at the rotator cuff, the main areas here is the teres minor. You have the infraspinatus, the supraspinatus, and the subscapularis. Now, keep that in mind just for a second. If I go here, 1 second here. If I can find this right here. Okay, right here. If you look there, this is good information right here. This shows you the actions. Most people who have rotator cuff problems, it's a supraspinatus muscle. Supraspinatus goes basically right over the top of the shoulder, right into that, right over the head of the humerus. And supraspinatus abducts. This allows our arm to come straight out like this. Abducts means away from the body. The infraspinatus, the teres minor, actually externally rotates. So if I come up like this, it's going to come out from here to here. And the subscapularis internally rotates, goes inward. So we have two muscles, the infraspinatus and teres minor, that actually, externally rotates. External rotation for us is more important. If we have too much internal rotation and we do too much of our arm pulling in towards our body, that's going to affect that rounding of that shoulder. Now, how many guys out there or girls work out regularly? Okay, here's a problem. If you're strengthening your chest too much, doing benches, whatever you're doing, and you're pulling down like lats, doing the lat pulls like this, the latissimus dorsi back in here, and your pectoralis major and minor in here, I know you hear that beating in the mic right there, they both attach in the front of the shoulder right here. So when these muscles attach under here and they get too strong, it's going to pull the shoulders forward. That's why you see a lot of guys, big, buff, strong guys with rounded shoulders, because these muscles are overpowering the rhomboids in the middle trapezius. Make sure you keep the middle trapezius and rhomboids strong by doing rhomboideus exercises. We've got hundreds and hundreds of videos on posture on my channel, on Motivational Doc. I ask you kindly to share them with your friends, share them through Facebook. There's so many good exercises. I get about 400 to 500 emails a day, and about 85 to 90% of them are thank yous, which gives me the feeling of I want to do more to help you guys. That's why I'm here, because people are so appreciative. People are loving. I made lots of friends with so many people worldwide, and our life is about helping each other. I hope you guys learned a lot, by the way, guys, because every time I come here, I still learn. There are so many different exercises and stretches that we pull out regularly that we don't see every day. And even these things are new to me. And when I say new, refreshing to me, because we may not use these things for years and years. And I say, wow, that's a great little stretch. Now you notice a lot of these stretches and a lot of these isometric exercises are all very, very safe. But the most important thing for all of you, is this. Don't do something if it's hurting. You're going to have a little distress, but don't push it. You have to go gentle. Remember, these conditions took a long time to get there, and it's going to take time to heal. And in many of you, you'll notice as you start putting through range of motion, you're going to say the next day, wow, I went from here to here in one day, and I couldn't do this for 2 years. And about 3 days later, Zaran, thank you, my friend, love you too. And then 3 days later, you say, wow, I can go here to here. And I couldn't do that in 2 years. And I've only done this in 3 days. Well, the most beautiful thing about the body is that when you get something, like you increase motion, you increase range of motion, when you get something, it's yours. I mean, it's yours. So don't ever forget that. So all that hard work, all that therapy, all that rehab, if you do things correctly, great. And the reason why I'm here, I'm saving you guys lots and lots of money, lots of time. This is something, a lot of these things, as I said, make sure you get it diagnosed first or cleared first from your doctor or therapist that this is what you have. And here is basically your bread and butter. This is everything that you need. I'm handing you things to take and to use these things so you can get well. That's basically what it's all about. All right, guys, listen, I thank you. I ask you to share these videos and put likes. I hope whatever you like to do, it's fine. But I enjoyed being here with you, and we'll be in touch in the near future. God bless everyone. God bless you, your families, your loved ones, your children. Make it a great day, and we'll catch up with you real soon. Bye-bye now.